I've always said that pediatric rehabilitation chose me more than I chose it. I thought in the beginning that I was going to be an adult rehab provider that did mostly procedures. When I did my pediatric rehabilitation rotation during residency, I fell in love with the ability to see kids get better from day to day. That's the reason why I decided to pursue this for the rest of my life. My favorite thing about incoming trainees is being able to understand where they are in life and actually start seeing within the first couple of months starting to become the person that they want to be.
The Pediatric Rehabilitation Medicine Fellowship here is a 2-year ACGME accredited program. It's split up between your first and second years. 4 months of inpatient and the rest of the months in outpatient as well as selectives and electives. And then in the second year, we also have you do 4 months of inpatient and consults, doing some outpatient rotations in private clinics, as well as procedures spread out across those couple of years.
We try to encourage excellent communication between our team members so that we can cover all of the patient's needs. These two allow us to discuss cases and ask each other hard questions when it comes to patient management to provide better care for our kiddos.
In the Pediatric Rehabilitation Medicine Department, we do a lot of collaborative research with other specialties within the hospital, including neurosurgery, neurology, and orthopedic surgery. We have a pretty big focus on spasticity management and surgical spasticity management through our movement disorder program. We're really fortunate to have a 3D printer. This drive came from the inability to be able to get access to some of the equipment that we needed kind of quickly. Some children may have difficulty moving, say, their left arm. And so what will happen is if they're in the wheelchair, sometimes it will slide off. And so we've been able to 3D print some arm troughs so it can help position them a little bit better. Instead of having to wait weeks from a durable medical equipment company, we're able to quickly 3D print something like that.
We want to make sure that the fellows get appropriate exposure to every single area of inpatient and outpatient pediatric rehabilitation medicine that we can. We want to make sure that we get their academic approach from that, but we also want to make sure that they have other interests that can be fulfilled that may make their experience at Riley Hospital better. We try to make sure that everybody gets ample time to pursue academic objectives as well as clinical objectives.
Some of the things that we're looking at in our research projects include looking at outcomes after selective dorsal rhizotomies, also looking at a newer kind of concept of doing hemi selective dorsal rhizotomy. We're also looking at the intrathecal baclofen pump program in terms of infection rates or complications, and seeing how we can improve our processes here at Riley to optimize patient care and patient function.
As a fellow, you come into this program to cultivate the true values that you're going to follow as a physician for the rest of your life. And it is our job to guide them through that process and not to mold them to what we want them to be, but to allow them to grow into their real doctor, their grown-up doctor.